Devin.
Well, at the height of the coronavirus outbreak in Metro Detroit, many coronavirus patients were put in nursing homes to recover. Right now, that policy still stands despite numerous calls for the governor to change it. Now a healthcare group says they support the decision. Rod Maloney spoke with the governor one-on-one today about this. She has hinted, Rod, that she is open to changing the policy.
Well, and you know, here's the thing, Devin. One of the complaints has been that the state's numbers on nursing home deaths, long-term care deaths, have not been very good, and they've been held back because they're still trying to compile them. This is a federal database. It's the Centers for Medicare Policy. And I'm going to put this right here over Michigan, and it says that 2,297 people have died in Michigan nursing homes. And that would be, based on today's number of 5,698, 40% of our deaths came in nursing homes. So now the legislature has a couple of bills saying they don't want to put COVID-positive patients in the same building as COVID-negative anymore. The governor says she's now willing to listen. The governor set up nearly 24 regional hubs, mostly in southeast Michigan. They're required to separate the COVID positive from the COVID negative under the same roof. None are required to take patients. Instead, they received a $5,000 bonus per patient. The Healthcare Association of Michigan saying it was to cover construction costs to build in that separation. Today in Lansing, House Appropriations Subcommittee on Health and Human Services took on the policy. Critic and Detroit State Representative Leslie Love asked Healthcare Association President Melissa Sunland about its origins.
And there was tremendous pressure to discharge individuals back into long-term care settings. PPE at the time was not a priority for long-term care settings, and neither was testing at the time. So yes, we felt a reasonable approach was to work with facilities who could dedicate a floor or a wing or a part of the building if they had appropriate levels of PPE.
Both the House and Senate are now considering bills that would prevent the COVID positive from being admitted to a nursing home. In an interview with Local 4 this afternoon, the governor weighed in on that drastic change.
It's something that I would obviously want to understand very, very well and work with Dr. Caldoun to make sure that whatever the policy is really is reflective of the best science and the needs. But certainly that's something that I'm open to.
Now, in Lansing, these bills are in the early stages, but the hope is from some of the sponsors is to have it finished by next week. Back to you.
Well, Rod, there are so many families desperate to visit a loved one these past few months. What are the prospects for that now?
Well, the Healthcare Association CEO there said that they are already in the process of putting together protocols for that. She says it's likely to be rolled out slowly like everything else has been in this case, but they say that they're working on that, and families desperate to see their loved ones may get that chance here before too long.
Let's hope. That's really been a crushing part of this for a lot of families, no doubt. All right, Rod.